Unsere heutige Thema.
Hi everyone, today we are going to talk about market, low demand and
Today I am going to speak about choose sensitivity, and there are also some questions about our topic that I'll try to answer all of them and give detailed information about each of them. The questions are the followings. First, what is sensitivity of teeth? What happens when a tooth is sensitive? What causes sensitivity? Do you suffer from tooth sensitivity? How do I know if I have tooth sensitivity? When are the teeth more likely to be sensitive? Is there anything I should avoid if I have sensitive teeth? What are the best ways to prevent tooth sensitivity? And what are the symptoms of sensitivity? What causes sensitivity after dental crown placement? How are sensitive teeth diagnosed? What are treatment options? Does teeth whitening make my teeth more sensitive? What can I do about the pain? And the last one, what treatments can the dentist offer? What is sensitivity of teeth? Sensitivity of teeth or dentin hypersensitivity is a condition in which there is a sudden sharp and shooting pain in a tooth when it is exposed to external stimuli. External stimuli involve thermal, chemical, evaporative, tactile, and osmotic. This means tooth pain occurs when there is exposure to foods and fluids that are hot or cold, foods that have citrus content, sugary foods, and hot or cold vapors. When a person with teeth sensitivity consumes these foods, they can be mild to sharp pain and discomfort. What happens when a tooth is sensitive? Enamel, the hard outer layer of the tooth, can sometimes be lost, which exposes the soft inner layer of the tooth, known as dentin. If dentin is exposed in the presence of a stimulus, such as a cold drink, the fluid inside small tubes in the dentin flows toward the dental pulp or nerves, and the pressure causes a sudden pain. The pain quickly disappears and doesn't cause any permanent damage to the tooth. However, this pain can be very unpleasant and have an impact on our daily life. It is the picture of healthy tooth and also sensitive tooth. Their characteristics are shown there. First, healthy tooth, enamel, dentin, pulp or nerves or vessels, and gum, cementum, jawbone, root canal. And also the right side, sensitive tooth, plaque, exposed dentin, inflamed bleeding gum, gum recession, and destruction of bone. Sensitive teeth pain relief. While the internet is filled with one sensitive teeth remedy after another, few address the underlying cause. If your tooth sensitivity is caused by a cavity or gum disease, you will require professional dental treatments to fix the problem. If the tissue is related to exposed dentin, your dentist can provide a fluoride varnish, foam, or gel to strengthen enamel and dentin. Bonding agents can also be used to seal the dentin surface, providing a barrier to the stimuli that promote sensitivity. What causes sensitivity? There can be many reasons which cause tooth sensitivity, and your dentist is the best person to diagnose any underlying dental problem for your sensitivity. Common causes include: first, aggressive brushing. Scrubbing the teeth with a hard or medium toothbrush can wear away the protective enamel layer of the tooth, leaving the dentin exposed and causing sensitivity. The next one, tooth erosion due to acidic food and drinks or stomach acid from reflux or vomiting. Gum recession that leaves the root surface exposed. Tooth decay, wound fillings and broken teeth that expose the dentine of a tooth. Grinding and clenching teeth at night during sleep, causing the enamel to wear away. Routine dental work such as fillings, crowns, tooth whitening, and a scale and also clean can all result in temporary short-term sensitivity. It's also the picture and the causes of sensitive teeth. There are some causes, for example, cracked tooth, tooth whitening, dental treatment such as deep fillings, crown placement, and also tooth cleanings. And right side, thinning of enamel due to overbrushing or erosion, and dental decay, poor oral hygiene leading to plaque and tartar buildup, and the last one, gum disease with possible recession and root exposure. What are the symptoms of sensitivity? If you have sensitive teeth to cold, the symptoms are pretty straightforward. Anytime you eat or drink something cold or even breathe in cold air, it can set off a sharp, jolting sensation through your teeth. Some of the most common times people notice cold sensitivity include the following. For example, drinking ice water or other cold beverages, biting into ice cream, brushing and rinsing our teeth, and side effects associated with teeth whitening products. Most cold sensitivity comes and goes, depending on what causes it. It rarely lingers or lasts for a long period of time. Generally speaking, it will usually wear off in a matter of seconds, but then flare up anytime your teeth are exposed to cold temperatures again. And it is also the forms of sensitive teeth. First, the sore sensitive, and the second is caused by cold and is called sensitive, cold sensitive. The last one, hot sensitive. How do I know if I have sensitive teeth? If you avoid certain hot or cold beverages because you know that your teeth will hurt or that those products will cause you discomfort, this might be the first sign that you are suffering from tooth sensitivity. And hot or cold drinks aren't the only indicator. There are also some other factors. For example, people with tooth sensitivity sometimes report that cold air bothers them, as does breathing through their mouth. Eating and sore foods can also cause an adverse reaction. Even routine dental hygiene, like brushing and flossing, can also cause twinges of discomfort for those with sensitive teeth. Does eating an ice cream or sipping a cup hot coffee turn out to be ordeal for you? If so, you may be experiencing teeth sensitivity. While the sensation may be temporary and intermittent, the condition is permanent and can worsen with time. It is important to visit the dentist and understand the root cause of sensitivity. Further to that, simply switching to desensitizing toothpaste will protect tooth enamel and extend effective relief to your gums. When are teeth more likely to be sensitive? You are more likely to feel the sensitivity when drinking or eating something cold, from cold air coating your teeth, and sometimes with hot foods or drinks. Some people have sensitivity when they have sweet or acidic food or drinks. The pain can come and go, with sometimes being worse than others. Is there anything I should avoid if I have sensitive teeth? You may find that hot, cold, sweet or acidic drinks or foods like ice cream can bring on sensitivity. So you may want to avoid this. If you have sensitivity when brushing your teeth, with cold water from the tap, you may need to use warm water instead. It's important to keep brushing your teeth regularly. If you don't, this could make the problem worse. And cavities and cracked teeth is also another factor for tooth sensitivity. Cavities are a common cause of sensitivity. Early cavities often have no symptoms. However, bacteria spreading further into the tooth will irritate the nerve. At this point, many people develop cold sensitivity. A dentist or hygienist must diagnose the cause. Cavities that can be seen are large and have spread quite far into the tooth. However, those developing under old fillings or crowns are more difficult to diagnose. Such cavities are hard to spot even when looking into the mouth or using X-rays. Suspect a cavity if the twinge doesn't go away after using desensitizing toothpaste for a few weeks. If a cavity is the cause, your dentist can place a filling, crown, or other type of restoration in the tooth. However, if a cavity has spread deep into the tooth pulp, a root canal may be needed that time. Cracked tooth syndrome is also common, and fine cracks make teeth very sensitive to cold. They are most often found in molar or back teeth. Very large fillings, cavities, clenching or grinding teeth, or a trauma often causes this problem. Biting chew or hard foods, such as pretzel, is the most common trigger of this pain. And it is cavity and crack. As I said, there are some factors that cause tooth sensitivity. Do I have a cavity or sensitive teeth? Cavities are the result of tooth decay, and the pain they cause can feel like tooth sensitivity. But they are different. Tooth decay happens when the sugars in food and drink react with plaque to produce acids. These acids can gradually soften and dissolve your enamel and dentin, creating a hole in your teeth and known as cavity. The pain from a cavity tends to be a dull ache that may be triggered by eating or biting down on something and may resemble sensitivity pain, which is often caused by cold or hot food and also drink. Best ways to prevent tooth sensitivity. The best thing you can do for your oral health and your overall health is to take care of your teeth, which will help to prevent any dental problems like tooth sensitivity from occurring. Some of the things you should be doing are to brush your teeth regularly. When you are brushing your teeth properly twice a day for 2 minutes, it can reduce the chance of tooth sensitivity. You should also be flossing your teeth daily to get rid of plaque on the gum line and between your teeth. Eat foods that are low in acid to keep your enamel strong. If you are doing everything you can to prevent tooth sensitivity and your teeth are still very sensitive, you should have a conversation with your dentist. What causes sensitivity after dental crown placement? Sensitivity after dental crown placement results from the removal of natural tooth structure before the crown is placed at dental surface or at dental practice. Some of that removal may be due to the restorative treatment. To gain access to a root canal infection, for example, dentists will need to drill into the top of the tooth. And once the restorative treatment is completed, further natural tooth structure will need to be removed so that crown can fit snugly over your natural tooth. This alteration in the shape of your tooth can leave your tooth feeling more sensitive or off for a few days following dental crown placement. Most patients experience a significant reduction in sensitivity over the course of the first few days, and complete or nearly complete cessation by the end of the first week. How are sensitive teeth diagnosed? An accurate diagnosis is needed in the case of sensitive teeth as against temporary palliative measures, as sensitive teeth can be a sign of hidden dental problem like periodontitis, and acute necrotizing ulcerative periodontitis or acute necrotizing ulcerative gingivitis. Diagnosis of sensitive teeth begins with a thorough dental examination that looks out for cracked teeth, presence of receding gums, dental decay, and also other conditions. Once the degree of tooth sensitivity is ascertained along with the causes of sensitive teeth, preventive care and treatment of sensitive teeth are prescribed. Though often a conversation with the dentist is all that's needed, dental hypersensitivity can be a challenge for patients to describe, making it harder for clinicians to accurately diagnose. By nature, it is a diagnosis of exclusion, meaning condition that can mimic symptoms of dental hypersensitivity must be ruled out via a differential diagnosis. And other conditions to rule out which may be mistaken for dental hypersensitivity include: first, fractured restoration. It is common. Dental caries, chipped teeth, post-restorative sensitivity, marginal leakage, pulpitis, palatogingival groove. What are treatment options? Also, there are some options. Now I am going to speak about first three of them. First and foremost, you should make an appointment at any dental center. If it is, you will be walked through all the appropriate options from the range of treatments and advise you on an optimum individualized treatment plan. And the second one, special toothpaste. It is very important. Most pharmacies stock several over-the-counter desensitizing toothbrush. Desensitizing toothpaste improves the relationship between the tooth surface and the nerve inside the tooth by blocking the transmission of sensation hitting the surface. And fluoride. Dentists applied fluoride treatment can strengthen tooth enamel, which reduces tooth sensitivity and also reduce pain. We can also help you determine whether you are a good candidate for a prescription fluoride custom tray, which is an at-home treatment. A filling, crown, inlay, or bonding when extreme sensitivity is the result of exposed dental root, one suitable treatment is a process called bonding. Gum graft, a relatively minor surgical procedure. Gum grafts can be used to treat tooth sensitivity. When the source of sensitivity is receding gum tissue at a tooth root, experienced dental center team will remove a small sample of gum tissue from another part of your mouth and reattach to the site that is causing the sensitivity. Covering the exposed root will eliminate any sensitivity arising from that site. Root canal. In extreme cases, if your tooth sensitivity isn't responding to the more common treatments listed above, a more intensive process like a root canal may be needed. Root canals, while a measure of last resort, are highly successful in treating lingering tooth sensitivity. Does teeth whitening make my teeth more sensitive? Sometimes teeth whitening treatments can wear down tooth enamel. It's also a common way. This kind of sensitivity is usually temporary, but continuing whitening treatment without consulting your dentist might exacerbate your sensitivity issues. That means you should head straight over to any dental center if you think this might be your situation. We understand our patients' desire for bright white teeth, but we also know that some people's teeth are more sensitive to certain bleaching treatments than others. It is another reason why we encourage you to come in for a consultation before embarking on your tooth whitening journey, so you can be sure that you avoid undue sensitivity down the road. Okay, it is a picture of tooth whitening way. What can I do about the pain? All of the conditions listed above can cause your teeth to become infected. This, along with inflammation, is what causes the pain you feel. If your tooth is infected, sensitivity toothpaste won't be able to cure the infection. The best course of action to treat an infected tooth is to perform a root canal. Okay. It's also the forms of sensitive teeth. First, it is caused by cold. Second, by hot drinks or hot foods, etc. The next one, smoke. Smoke also is important factors that cause tooth sensitivity. And the last one, sugars. In order to protect our teeth from tooth sensitivity, we try not to use such foods. Okay, managing tooth sensitivity. Choice of toothpaste. Tooth sensitivity is common enough that some brands of toothpaste are manufactured to reduce tooth sensitivity. The benefits of such toothpaste are gradually realized, and it might take a month or more of regular brushing with the toothpaste before any benefits are apparent. On the other hand, some types of the toothpaste will actually worsen tooth sensitivity. In particular, toothpaste for whitening teeth and tartar control toothpaste containing sodium prophosphate can exacerbate tooth sensitivity. And toothbrush. A worn toothbrush or one that is too hard can also increase tooth sensitivity to temperature, as can brushing too vigorously, because these things can work to expose dentin. It is worn toothbrush, the picture of worn toothbrush. The usual reason for temperature sensitive teeth is that the dentin, the part of the tooth that allows heat or cold to most directly reach the sensitivity internal nerves of the tooth, has become exposed. Such exposure usually is a consequence of gum erosion or thinning or weakening of the tooth enamel. When the dentin is exposed, tiny tubules that lead to the tooth pulp, nerves or vessels are exposed. If heat, cold or acidity travels along these tubules to reach the tooth pulp, a sudden sharp pain can result. What treatments can the dentist offer? During an examination, the dental team will talk to you about your symptoms. They will look at your teeth to find out what is causing this problem and to find the best way of treating it. The dental team may treat the affected teeth with special desensitizing products to help relieve the symptoms. Fluoride gel, rinses or varnishes can be applied to sensitive teeth. This can be painted onto the teeth at regular appointments, 1 or 2 weeks apart, to build up some protection. Sensitivity can take some time to settle, and you may need to have several appointments. If this still doesn't help, your dental team may seal or fill around the neck of the tooth, where the tooth and gum meet, to cover exposed dentin. In very serious cases, it may be necessary to root fill the tooth. Okay, it's vocabulary of our topic. There are some essential words from our topic, and I would like to give their explanation. First, to expose, to show something that is usually hidden. To consume, to use something, special fuel, energy or time. Temporary, lasting or intended to last or be used only for a short time. not permanent. Intermittent, stopping and starting often over a period of time, but not regularly. Permanent, lasting for a long time or for all time in the future, existing all the time also. To extend something to make something longer or larger. Scrubbing, to clean something by rubbing it hard, especially with a brush and usually with soap and water. Erosion, the process by which the surface of something is gradually destroyed through the action of wind, rain, etc. And reflux, the fact of the liquid contents of the stomach flowing back into the esophagus. And destruction, the act of destroying something, the process of being destroyed. Abscess, a swollen, it's also equal and similar in larger than normal, and painful area on your skin or in your body, full of thick yellow liquid, or it's also called pus. Wear down, to become or make something become gradually smaller or smoother through continuous use or rubbing. Ailment, an illness that is not very serious. Cement, grey powder made by burning clay and lime that sets hard when it is mixed with water. Varnish, a liquid that is painted onto wood, metal, etc., and that forms a hard, shiny surface that you can see through when it is dry. Sensitive, reacting quickly or more than usual to something. Sensitive areas of the body, for example, we can say pulp, a soft wet substance that is made especially by pressing hard on something. Seal, to cover the surface of something with a substance in order to protect it. Linger, to stay somewhere for longer because you don't want to leave, to spend a long time doing something. And penetrate, to go into or through something. Adhere, to stick to something. To avoid, to prevent something bad from happening. Cracked, damaged with lines into its surface but not completely broken. Beverage, any type of drink except water. Palliative, a medicine or medical treatment that reduces pain without curing its cause. Necrotizing, a serious infection that causes cell tissue to be rapidly destroyed, chip teeth. Restorative, connected with treatment that repairs the body or a part of it. Leakage, an amount of liquid or gas escaping through a hole in something. An occasion when there is a leak. Pulpits, a small platform in a church that is like a box and is high above the ground, where a priest and also etc. stands to speak to the people. And the last one, groove, a long, narrow cut in the surface of something hard. All these words listed above are very important and also are from our topic, and I gave detailed information about them and also gave their explanation. Okay, that's all.